The U.S. Surgeon General is in Montana this week to assess the state's COVID-19 situation. He said there are positive signs, but people need to continue what they are doing to slow the spread. MTN's Jonathan Ambarian reports.
On Thursday, U.S. Surgeon General Jerome Adams joined Governor Steve Bullock for a news conference at the Montana State Capitol. Adams noted the country is currently going through some of its deadliest days for COVID-19, but he said he sees reason for optimism.
Montana has proven that these mitigation efforts work.
Adams said he's pleased to see that the rate of positive COVID tests in the state has gone down in recent weeks. He credited that to people taking steps like wearing masks, distancing, and keeping gatherings small.
We know more than we ever have before about this virus, and we know statistically that your efforts are working to slow the spread.
However, he remained concerned that many Montana hospitals remain close to capacity.
That means if you aren't scared of the virus, you still may not be able to get a hospital bed if you have a heart attack, if you're in labor, if you get into a car accident, because there may not be a bed available.
Adams acknowledged some people have questions about the health guidance they hear, since experts have changed their advice as they learn more about the virus. But he said data now shows clearly that masks work to limit the spread, and that the new vaccines will be safe and effective.
We will have more data on the safety of these vaccines at the point of administering them to people than we've had for any other vaccine in history.
Bullock said the state expects to get its first shipment of vaccines next week once they are federally approved. They hope to have 60,000 people receive a first dose by the end of the year, starting with healthcare workers. Adams noted tribal communities have been hit particularly hard by COVID. On Friday, he'll travel to the Fort Peck Reservation for the opening of a surge testing site. In Helena, Jonathan Ambarian, MTN News.
Bullock said nearly 300 healthcare workers from outside Montana are now contracted to work in the state to help hospitals under strain.